My first guest tonight is Dr. Brett Bolton. He's a trichologist in Fort Lauderdale, Florida. And, of course, I never knew what a trichologist was until I found out a trichologist focuses exclusively on hair and scalp health. Dr. Bolton, welcome to NightSide, sir. How are you?
Hi, thank you so much for having me. I'm doing wonderful. How about yourself?
I'm great. Well, we're still dealing with snow up here. I know in Florida that's a rare occurrence, but it happens all too often here in New England. Anyway, that's not what we're here to talk about. What we're here to talk with you about is the question of whether or not overseas medical procedures are worth the risk. Now, this is what's called medical tourism. I assume that you want to talk about medical tourism generally, or do you just want to talk about people who are going overseas to have, I guess, hair transplants or plugs? Which are we talking broadly based or more specific in the practice of trichology?
Okay, so I'm a hair transplant surgeon. That's all I do. That's all I've ever done. I've been doing it now almost 30 years. And now more than ever, we're seeing an influx of patients that are actually coming back from their procedures from overseas. And we're seeing lots of complications that they're having. Now, I'm not saying that's the case for all of the cases, but my practice is mostly focused on corrective surgery. And the story I've been telling lately is I had about a week where all 5 of my patients, they all happened to have come from Turkey, and they were all corrective surgery procedures, whether it was an unnatural growth of grafts or how they harvested the donor tissue, or they had unnatural-looking hairlines, all of which, can be corrected. But what's happening is the patients are seeing these social media influencers, and they see the best-case scenario. And they show it, they glamorize it. Oh, you're going to get picked up in a limousine. We're going to take you to this beautiful hotel. It's cheap, and we're going to do this great job for you. And I'm not saying you can't get a good job in Turkey, because I've seen plenty of nice cases. However, there's the other side of it where they're not getting the great results. Yeah. And so I always use the term buyer beware. And so I always tell everyone, you have to ask the right questions prior to getting your procedure done to make sure you're getting what you're specifically looking for.
Well, of course, in Latin, caveat emptor. I'm sure you're familiar with the Latin phrase as well, but that's one that we invoke here on NightSide regularly. And, of course, there are a lot of times when I like to say, when your mother told you that if the deal sounded too good to be true, it probably was. So here's my question, and I've never talked with a trichologist before, okay? When you talk about what's going on overseas or in your office, is this what we used to refer to as hair plugs? I remember when Joe Biden was a senator, a younger senator, yes. And he had hair plugs. Are hair plugs, have they gone the way of the dodo bird?
Okay, so what you're saying, you're 100% correct. The hair plug is obsolete for the most part. What we're doing today is we're doing one hair graft at a time. So instead of using what they were doing in the past is they were taking a punch biopsy, picture a hollowed out pencil with a blade, and they were taking these punches that would have, 2-3 millimeters of diameter, and they might have 15, sometimes even 25 hairs in some of those big old plugs. Yeah. Because of the size of the graft, the plug, as you referred to, they'd have to space them out in order to make sure they had enough blood flow. That's why they were so spaced. Yeah. And so because they were big, they would turn and they'd have different hair growth as far as the directions and angles of the hair. They were unsightly because they didn't have the softening, which we're doing today. And, the way they were harvesting the donor by doing that punch biopsy incision, they were destroying the donor hair. It affected the blood supply. It affected the nerve supply. They look moth-eaten in the back.
So therefore, it sounds to me like what you're saying is that there's been a great deal of progress in your field over the last 30 years.
Yes and no. So what happened was once the one hair graft was introduced, I was at the conference in Barcelona in 1996. That revolutionized the hair transplant industry. And then at that point, they were doing strip harvesting, which is the method where we open the donor up with a blade, and we're able to see the follicles underneath in order to make sure that the follicles aren't being transected, being cut. So they're good, clean follicles. So we were getting the one hairs, that we were doing the follicular units. That's a naturally occurring bundle of hairs, groups of hairs we all have in the back of our head. Might have 2, might have 3. Rarely you might see a 4 hair, but usually it's about 2 to 3 hairs. Sometimes you might even have a 1 hair follicular unit. Anyways, the industry went from those big plugs all the way down to just single hairs in the front, and then they were putting those little follicular units everywhere else. So what happened is the patients at that time, when they were doing the strip harvesting, they were getting a lot of hair. And so a lot of the doctors that were, around for a while, they're like, wait a second, my patients aren't coming back as much now as they did when I was doing those plugs. Because I could do 100, 200 plugs, do 10 patients a day, and they have to come back all the time and keep getting more. But this strip method was giving too much hair is what really happened. So I'm not going to mention the doctor's name, but he was one of the doctors who created this. And then he decided to create what's called a follicular unit extraction. So now he went back to where the plugs harvesting with that punch biopsy, and instead of punching out those big holes, he started only punching out follicular units only, that tiny, small little bundle. So now instead of a 2-3 millimeter punch, they're down to a 0.8 or 1 millimeter punch biopsy. And what they're doing is they've recreated the same side effects we were having with the plugs. So they went backwards in a sense. And the reason why that technique became so popular is because the doctors don't have to do the harvesting. So they'll bring in technicians to do the harvesting. So it might take 4 to 8 hours just to poke the holes out of the back of the head. Whereas if I were to do a strip surgery, I can have, let's say 60, 70 square centimeters of tissue, approximately equivalent to about 12 to 14,000 hairs if the patient has average density, versus theirs, which might take, a full day just to get the hair out, and they won't even get it nearly as much as you can get with the strip surgery. So, yes,
it sounds like a lot of work, Doc. It sounds like a lot of work.
It's too much work. It puts the patient under the anesthesia too long. They're pulling the tissue out of what's called the safe zone. So, you think of the bald guy, right, where they have that strip around the back.
Yeah.
So they're having to harvest much wider than where that strip would be. So if the patient continues to lose more hair, they could potentially lose these grafts. So they went forward, but then they took a step back, in my opinion, with this follicular unit extraction method. Okay. And that's what they're doing in Turkey.
So let me ask this, because what I want to do, I want to get to this. I got a pretty good head of hair. I was on television for many years, so I pride myself on that. Okay. But what are people paying when they go to one of these overseas places and they think they're saving money? What is the differential? Is it like 10% of what they would spend here?
Here's the kicker. They're paying a fraction of what they would pay in the United States, and that's what's enticing everybody.
Okay, so but with all due, doctor, a fraction could be 3/4 or 1/5.
Okay,
give us
I'll tell you
rough
exactly.
idea.
In the United States, for a quality hair transplant surgeon to do your procedure, you're going to pay, 10 to 20 grand, let's say.
Sure.
There, you're going to pay 2 to 5 grand.
Yeah, huge difference. Huge difference.
It's a huge difference, and it makes it enticing to everybody to say, hey, it's worth giving it a try.
So let me ask you one more question, one more topical question. Sure. You see a lot of stuff on the internet for people who have gone bald or who are going bald, and they talk about this shampoo, that shampoo. In the last 6 months, I've seen a lot of that sort of stuff. Is that stuff, does it work, and does it have an impact on your practice?
So yes and yes. So if the products have the FDA-approved treatments, the main one you're going to find over the counter is Rogaine, which is minoxidil. Mm-hmm. So if the product has that inside and you're using it regularly, then yes, that could help to prevent future hair loss for sure. The other FDA-approved treatment that's out there is Propecia, which I always recommend. Yeah. But in your answer to does it affect my business? Well, what affects our business is that there's all these online pharmaceutical companies, like let's say Roman or Hims, or you can go online and they're marketing like crazy, and you fill out a form and then they prescribe you these FDA preventive treatments. Yeah. What the patient doesn't realize is these are generic, and you can go to Costco and get a whole year of finasteride for $30. You can go to Walmart or Costco and get your minoxidil for a few dollars a month, and they're paying these, a lot more than that monthly for the same product. But what that's done is open the door for patients to not have to go get a consultation. They're treating themselves. Social media influencer told me to do this and this.
We should do. This might deserve a longer conversation some night. Okay.
Okay.
And I got backed up here on time because I think it's interesting. And half my audience probably has concerns about this. We may have you back if that's okay, and take some phone calls from listeners. You're really good. You answer questions directly, which I like, and you're very knowledgeable. So I thank you for your time tonight, and don't be surprised if we have a return visit fairly soon. Okay.
I appreciate that. Thank you so much,
Dr. Brett Bolton of Fort Lauderdale. If folks want to get in touch with you, they can just look up Brett Bolton in Fort Lauderdale, Florida.
Absolutely. Thank you very much.
Thank you very much, Dr. Bolton. When we get back.